Thing, this is a confidence thing, right? This affects the way we act in our everyday lives, the way we feel about ourselves. But oftentimes, it seemed the only way to truly treat it would be to make appointments at clinics and spend so much money, multiple trips, to try and make a difference. Well, now we have the opportunity to show you a product that is an FDA-cleared medical device using laser therapy with that same technology and dosages that you would get in a doctor's office, but now you can do this at home with the privacy and the convenience. And look at these differences. In 6 months, we say worn once a day. What does that mean? Well, Capillus actually gives you that laser therapy in a baseball cap, right? Here's all the lasers, 202 of them to be exact, that you wear for 6 minutes a day. You could be driving to work, you could be eating your breakfast, having your coffee, checking your email, but in 6 minutes a day, you could start to not only keep the hair you have on your head, stop the shedding that's happening, but also help with the regrowth of new hair. This is a really important technology, and we had to bring in the experts for it. Barry Pintar has spent 30 years in the hair loss industry. Now, this is impressive. So not only do you handle the training and the education for physicians and hospitals and clinics, but you've also sat with thousands of people who suffer from hair loss.
It is.
And counseled them and educated them on this technology, right?
Exactly. And as you say, Michelle, this is a big issue for so many people. Hair loss is a life-changing situation for folks. Unfortunately, so many people feel like they've been ripped off. They've tried this, they've tried that. It didn't work. They did temporary topical things. They didn't last. They didn't look natural. It's important to say, we are talking here, Michelle, about biomedical technology that actually treats the follicle. This is not a cosmetic solution. This is a permanent medical solution to stop hair loss and cause hair regrowth. So then this is safe, it's effective, physician-recommended treatments. I mean, this is what I was saying you would go typically to an office for. This is an actual medical device that we're using. It is an actual medical device, and folks used to pay up to $80 per visit several times a week. The most important thing about this particular cap to mention, though, is what you may have seen in the past are things that had 8 lasers, or the consumer grade that had 80 or 82 lasers. The most important thing that I can tell you today is this is actually the type of device you would find at a doctor's office, and it has 202 lasers. So we're talking about powerful effects. You can see it all here. Very comfortable to wear. By the way, this does come out if you had another hat you wanted to put it into, you could. But battery operated, which means you can do it anywhere at any time, 6 minutes a day. Let's talk about what will this do and what will it not do? Like, who is this for and what can we realistically expect to happen? Excellent question. It's important to note that this medical device will reach down to your follicles to stop hair loss and make them healthy again. So what that means is this is not for someone who has experienced complete baldness. There are no follicles there. There's nothing to treat. However, if you are one of those people who hair has been thinning for years, you find that it's fine. You find that it's falling out continually. You're getting worse and worse. This is a perfect device for you because it will treat that follicle and it will actually make it healthy again. As simply as pushing one quick button. We'll go to our model. You'll see this more up close, more closely to see how it works. It turns itself off, completely regulated. So after 6 minutes, it's gonna shut off. I don't have to do anything. So you don't have to worry about anything. All of the medical experts have decided how this FDA-cleared medical device works. And speaking of FDA-cleared, at some point we should talk about that because that's super important. It's a very big deal. We've got Sonia just kind of showing how it's gonna work. You're just gonna put it on like a regular hat, push the button, and you're good to go. And as we mentioned, it'll shut off on its own. A couple things I wanna let you know about. We have the best way to bring products like this to you in an attainable measure. And what I mean by that is, not only do we have a great event price, we've taken about $300 off the price point for this, but we're gonna break this up over time for you. When you use FlexPay on something like this, that means you can break this down into 6 equal monthly payments without any kind of interest, without any kind of fees. You can use any major credit, debit card, PayPal as well. After that first payment, here's what's gonna happen. We're gonna send
send this to you. You start using it. You have got 6 months to use this. That's our return policy. We're not doing 30 days. It takes more than 30 days to regrow hair. We're not talking about a beauty treatment that washes out at the end of the day. We're talking about actually changing your life with a medical device. So you have 6 months to try it, see the results. I recommend everyone take a picture beforehand too. Do your own before and after. If in that time you're not seeing results you want, you're unhappy, send it back to us, no questions asked. Done and done. Those are just some of the reasons I feel like this is a really nice risk-free way to try something that, by the way, you own.
Absolutely.
That's it, you're done. There is no ongoing costs with this. And how long will this last?
Okay, so the lasers will last 82 years. So it's important to keep in mind, this is a once in a lifetime investment. For women, there are only 3 other options that you have to buy over and over again. One is a topical, one requires constant costly visits to doctors for injections. This is it in terms of recognized by the medical community for what you can do at home.
And this might be a weird question, but what's the room for error here? Like, what are the chances that I do it wrong? Because it just seems so simple. The other ways seem complicated to me.
And some of those other ways have side effects that the FDA requires us to talk about. The FDA allows us to say there are 0 known side effects with LLT, which stands for low level laser therapy. In terms of what you can do wrong, nothing, because eventually Sonia will show us you push one button, it turns on,
and that's it.
The computer chip turns it off 6 minutes later, once a day, and you're good to go.
Do I have to do anything special for women? Do they need to pull the hair up or have it move? It just doesn't matter.
This is a very specific color spectrum of light. Now, I'm holding my fingers over the sensors. Otherwise, it turns itself off when it comes off your head, as you saw. But this is called, to get specific, scientific on you, 650 nanometers of light. I say that because some folks who work in the medical community realize that this is a medical grade laser that they use in hospitals for wound healing, to help burn victims heal more quickly. This is a specific color spectrum of light, to answer your question, that will go through your hair, go through your scalp, and actually reach the follicles, as we saw in that animation.
And what does it feel like?
Okay, so let's take a look, and I'll show you exactly what's happening. Very specific color spectrum of light that reaches down through your hair, down through the scalp, and it's going to reach that follicle there, what a lot of people call a root, where the hair originates. That's what we're doing. We're actually stopping that hair loss and causing regrowth. It actually stimulates the cells in that follicle and brings it back to life. What happens is a follicle miniaturizes because of androgenic alopecia, which we may have heard of before, but we've seen it. Dad was bald, mom was bald. We inherited the genes. We start with a healthy follicle. It gets smaller and smaller and smaller. That's called miniaturization, until it's completely gone. We're working against the clock here. It's very important to get that follicle before it's gone, as you saw in that animation. So the light comes down, actually makes that follicle healthy again. So many of the folks who came to me just came to me to say, what can I do to stop my hair loss? What are the medical solutions?
A lot of times you'll notice your part starts getting bigger. That hairline starts moving further back. When you put your hair up, maybe the sides, you're noticing you're seeing more of your skin. I love that this is twofold, right? It's helping you stop the shedding and keep the hair you have, and then it's also assisting with that regrowth when it can get to the follicle there. And the best thing is you make it so easy because there's no complication. Like something like this, you have to be consistent. You have to do it every day. This is not some miracle thing overnight, all of a sudden, oh, I've got a new head of hair. This is a legitimate FDA cleared medical device, but oftentimes with that comes, I think, the complication and convenience. It's hard to do. You literally put this on your head for 6 minutes. I mean, there are so many times throughout the day, you could be watching TV, prepping dinner, checking emails, brushing your teeth. You just put it on. It shuts off when it's done, and you can finally start to see some results. And to me, that's groundbreaking, honestly.
It's huge and very real results. And you've said it several times now, FDA cleared. Can I take a moment to explain what that means?
Because there's a significant
It's significant, and again, I've met with folks like you, thousands of you, and you're so reticent. You're wondering, is this another gimmick? Well, let me tell you, you don't have to take Barry's word for it. You don't have to take Michelle's word for it. What it means to get an FDA clearance is the FDA has said that this technology is real. that it works, or you wouldn't get that FDA clearance. Then the FDA has said, not only is it real, it will do what it says it will do, but it is safe. If it weren't safe, if it weren't real and did what it says it would do, you wouldn't get that FDA clearance. And that's huge to so many people, not just like you and me and folks at home, but some of the most famous people here at HSN use it.
This is very true. You may know, for instance, Martino. So Martino Cartier, he brings us wonderful styling tools, a very successful salon owner and expert in the world of beauty. But this hit him personally too, right? It
was huge. And again, it's important to note that you have amazing experts under this roof who have access to everything. And you can see this was his choice.
My name is Martino Cartier, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus it's gonna help other hair come in thicker and more fuller like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
You gotta love Martino.
I do love him.
So great. And you know what? We have so many fantastic beauty products and hairstyling tools, but the difference here is we're not like treating the hair, we're going into the underlying issues, you know, and for so many people, that's what's important here because we're not just tackling like the shine and the way that we're truly going in and helping you with the regrowth and stopping the hair that's coming out.
Exactly.
Yeah.
It is a biomedical technology that is an FDA cleared medical solution. I know that's a mouthful, but it's important to say because it's real, that's actually going to treat your hair follicle, make it healthy so loss stops, regrowth happens, and you see amazing results. And again, as Martino said, access to everything. He wanted the best of the best, and I will say, even though I'm here with this product, that most doctors, major hospitals, the most famous that you could name, would agree with that sentiment.
Well, and the thing with this too is, it's that same technology, that laser therapy, but you said something to me earlier, it's the same potency as well. What does that mean?
Okay, so again, there are lots of other laser products out there you may have heard of. There's a brush that has 8 layers. There's more the consumer grade now that will have 40 or 80 or 82.
Lasers, you mean?
Actual lasers.
Okay.
This is 202 lasers. I tell folks, think of it like an aspirin or an extra strength aspirin. You can do the aspirin and you'll have some results that take away that headache, but when you do the extra strength, you really get that professional result. That's why we say this is professional grade, and as Sonia will show, it might sound like those are big words. It's professional grade, but it's simple to use.
Don't blink. She's about to do it right now.
Exactly. So Sonia could be sitting on the couch at home after she gets out of bed, having a cup of coffee, in bed reading a book. She could be cooking in the kitchen. She pops it on her head. She pushes one button right here. She pushed it, that one button, and instantly, can you see the red? The treatment has begun. All right.
You don't, what do you experience while you have it on? Will you feel anything? What will happen?
Great question. They're called low-level laser therapy, and they're cool lasers, so they generate no heat. The key is their color, which actually, as we speak, this is amazing, are reaching down through Sonia's hair, through her scalp, to her follicle, stimulating the cells in that follicle, making it healthy. I always say to folks, light equals life, whether you're talking about plants or healing in hospitals.
Very true.
And that's actually what's happening. That light is actually energizing those follicles back to healthy state.
Now, what about, we all have different types of issues when it comes to baldness or thinning hair. Who can use this and who can't? Because I know there are different classifications as far as like the type of baldness you may be dealing with.
Exactly.
Or hair loss.
So this is what's called the Ludwig or Savin scale of female hair loss. A lot of people experiencing hair loss will recognize it. That's exactly right, for females anyway. The part's getting thicker. It's getting thinner. This is called androgenic alopecia. Some people say androgenetic alopecia. Again, it's not news to these folks because they saw mom do it or Aunt Margaret or their sister. You know, they've they've seen it, they know this runs in their family.
Yeah.
So what's going to happen for these folks in the blue is they are going to stop that loss, which is the reason a lot of folks walked into my office in the first place. Please help stop my hair from falling out. But what they don't realize, and they're pleasantly surprised about, is they're actually going to cause regrowth, as we saw in those before and afters. Exactly.
So it's 6 minutes a day. Now, what happens now that I've been using this for months and months? I'm happy with my results. Do I keep using it all the time? Like, is this an ongoing thing? How does that work?
Yes, this is a commitment that you will do every day for a simple 6 minutes.
Okay.
Little fun fact, it used to be 30 minutes every other day.
I know, I was like, wow.
Well, you know, in the medical community, we have this word compliance,
Yes.
meaning the patient will do it.
Yes.
So the best heart pill in the world is no good if no one takes it.
That's right.
And folks were very good about doing 30 minutes the other day, but what we did is we went to the FDA and said, how about if we go 6 minutes once a day with the exact same treatment dosage for the month, and the FDA cleared that, so that now Sonia only has to wear this 6 minutes once a day, piece of cake, done, will turn itself off when it's finished.
And a side note, it's not a big deal, but being a female, I think I like the idea that you could take this out of this particular cap and put it into another cap, even just something to keep in mind. Maybe you're wearing it for your commute or whatever the case is, so that is
This
doable.
is the real medical magic here.
Right here, look at that.
Right here.
Okay.
And can you see there? And it's just sitting over this cap.
Yeah.
So if you wanted to put your favorite sports team or whatever, you can do that.
A few things to keep in mind here. I understand, you understand, we all know this is definitely a considered purchase. It's one of those things, and if you're watching right now, you've probably been thinking about doing something like this for a long time. This is not something you just all of a sudden decide to do, right? That is why at HSN, we want to make it as easy and attainable as possible for you. So one of the things that I love is that, first of all, we've taken about $300 off of our price point. We also offer you FlexPay, and if you've never used it before or you need a refresher, FlexPay is for everybody who's shopping. It's not something you have to sign up for. It's a way of making equal monthly payments without any type of interest or fees, using whatever major credit or debit card of your choice. I personally like to use PayPal. I mean, it's totally up to you, but what happens is, in this case, you make 6 equal payments of $283.17. You get your item right away after that first payment. We have also extended our return policy for this because we understand it's not a 30-day thing. This takes commitment, 6 minutes a day from you. We're gonna give you 6 months to try this out and start seeing those results. Take a before photo. I really think it would be worth your while to be able to go back and compare. But if in that half of a year time span, you're not happy with what you see, we're gonna take this back. So it makes it risk-free for you and much, much more affordable to do something that, frankly, used to be you'd have to go into the office, spend a ton of money, make multiple visits. Maybe you're using topicals or complicated, you know, electronics. It's easy, it's safe, it's FDA cleared, it's shown to work. And you have time to use it and see the difference.
Exactly. And Michelle, one of the reasons for that 6 months is we are talking about growing real hair. You do have to have an element of patience, but the payoff is huge because we're growing real hair. If we can take a look at some before and afters, I'll actually show you. This is Daniel, all right? This is that 6 month mark. It's going to really take 6 months until you look in the mirror and say, whoa, are you serious? Okay, but again, keep in mind, a lot of folks that came to see me would have been just happy if that before stayed the before. Because hair loss is progressive. It keeps happening. But not only has Daniel stopped losing hair, but here's the awesome part. Remember how I showed you what happened to those follicles reversing back into their healthy phase? You can see it in the after. The loss not only stopped, his fine, thin hair got thicker again.
You can see it right in the middle. You can see it right at the hairline there. Absolutely.
And Yvonne's another before and after. You know, we typically, there we go. Okay, so look at the part.
Wow.
You see how the parts, just like we saw in that scale, look how it filled in. So again, Yvonne would typically come to me and say, Barry, just let's stop the hair loss. Please tell me what I can do to stop my hair from falling out.
Let's not let it get
I would
worse.
say, there's great news, Yvonne. We not only can stop your hair from falling out, but we can medically take that tiny, fine hair, some of your eyes can't even see, and actually reverse it back into its healthy phase. And speaking of healthy, okay, look at her sides. We're looking at the part, but did you notice how shiny her hair was? We're growing stronger, thicker, healthier hair. This is Lester, same type of thing.
3 months.
Yeah, and this is in 3 months. But again, for the human eye, Lester may look in the mirror in 3 months and go, I think something's happening. That's why we're giving you 6 months. That's so important. And if I can show Sonia again, see the cover coverage. Let's say you're someone who's suffering a little thin here and a thinner here. What we recommend is wear it straight on one day, tilt it back 1 inch the next. Now see, straight on one day, back an inch the next.
Saying.
There is nothing that Sonia can do to get that full coverage, hands off like that. She's being cool. Yeah, exactly. Oh yeah, oh, I got it, you're showing the sides.
Right,
right,
would
right.
Make this
I
look
thought you were doing the baseball cap cool girl. Okay.
So funny. He's like, I'm at a loss for words.
Yeah.
No, here's the thing. I love the idea, too, the simplicity of this, but also you have complete privacy. It's very discreet.
It is.
Here's the thing. 6 months is going to pass regardless, right? So this is an opportunity to have that time pass, and at the end of that 6 months, you could see very significant changes here. And I use the 6-month term just because that's our extended return policy. But even outside of that, imagine not having to be self-conscious about wearing your hair up.
Huge.
Or someone seeing the top of your head, or, you know, for the guys constantly feeling like you have to wear a hat. You know, my husband is in his 30s, and he is definitely experiencing that, and his dad did, his grandpa did, they all did.
It was a
genetic thing for him. And you think I have to do
Father's
something
Day,
totally,
seriously,
oh my gosh, good idea.
Father's Day's coming up.
Yeah.
So, hey, grandmas, if you have a son, a grandson or a son, they will do cartwheels. Let them, bring them to the HSN website. Let them see this presentation that this is a real thing that doctors use. And you know, Michelle, speaking of doctors, there is a doctor who's really famous within the home shopping community, Dr. Dinesh.
Yes.
Wouldn't it be interesting to know if this is something she likes?
Let's take a look.
My name is Dr. Adrienne Dinesh. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
Look at that. You know what? And you purchase one of these, and maybe it's you and your husband, or you and your brother, or you and whoever. We can all use this.
It's one of the only modalities out there that the medical community recognizes that you can share. So yeah, you can find someone, let's go half-seas on it and use it together.
So I do want to say, we've got a couple minutes left in this presentation. If you are just joining us and you're wondering what this is all about, it's called Capillus, and it is an FDA-cleared medical device. This is that laser therapy, that same technology, and in fact, that same potency, I would say, that you would get in a doctor's office, but it's in the form of a little cap, takes 6 minutes a day for you to wear to start not only stopping the shedding and the loss that you're having, but also helping with the regrowth of that hair. And I love having you here, Barry, because you are the expert on all things education for this. So, I mean, in the last minute or so here, what do you want people at home to know about this system and why they should try it?
So what's happening is your hair is falling out. You've noticed that. The clock is ticking. If you don't do something, you're going to continue to lose. Your hair follicle starts healthy. You've inherited something in the past that's going to make it get smaller and smaller and smaller and die until it's gone. Wonderful news. The FDA has cleared a medical device that will actually stop your hair from falling out and causing it to regrow. FDA cleared means the FDA says this device is effective, or it would not have been FDA cleared. This medical technology will do what it says it will do. And to get the FDA clearance, you have to prove that this will do what it says it will do safely. So, Michelle, they don't have to take our word for it. Take the FDA's word for it, and be patient, folks, because you're growing real hair. And
give yourself the time to use it consistently and see those differences. You have 6 months to try this before that return policy would expire. So if in that time you're not happy, send it back. Take advantage of the flex payments. If you have an HSN card, by the way, you do get an extra flex pay, and you could get this home for $242. You pay that monthly with no interest whatsoever, and you could finally be on your way to better hair.
Exactly.
Right? More hair and more confidence as well. Barry, thank you.
My pleasure.
A really
pleasure.
cool product. I can't believe in my time here I've never had the pleasure of presenting this.
Father's Day, the husband.
I know.
Just saying.
It's true. It's a good idea. Thank you so much.
You bet.
You know, this entire hour we will be